Hi, my name is Courtney Young, and this is my presentation on attention deficit hyperactivity disorder, or ADHD. When we're provided with information telling us that anywhere from 5 to 11% of our students may be affected with a disorder, we need to take notice. So, what is ADHD? The Center for Disease Control defines attention deficit hyperactivity disorder, or ADHD, as one of the most common neurodevelopment disorders of childhood. Children with ADHD may have trouble paying attention, controlling impulsive behavior, or being overly active. There have been 3 types of ADHD identified. Those 3 types are inattentive type, hyperactive impulsive type, and combined type. That student who you keep wondering, why can't they just get it together? May be a student who has ADHD inattentive type. The signs and symptoms of inattentive type may include trouble staying on task, may not appear to be listening when you're giving instruction or simply speaking to them. They may do just fine starting a project or a task, but if the task takes a significant amount of time or requires a significant amount of attention and focus, they may lose interest easily and not be able to complete that task. They may be disorganized, frequently lose items, be easily distracted, and may be forgetful. Signs and symptoms of ADHD hyperimpulsive type could include things like fidgeting, tapping, squirming in their seats, getting up to move around the room frequently. They may run and climb, possibly on items that they shouldn't, that could be dangerous. They may not be able to sit quietly and play like their peers. They are always talking, and possibly at inappropriate times. They may blurt out answers and not be able to sit patiently and wait to be called on with their hand raised, and they may struggle to take turns. ADHD combined type is the type of ADHD that this child will exhibit signs and symptoms of both inattentive and hyperactive impulsive types. They will struggle both to maintain focus and restrict movement. Remember, as educators, it is not our job to diagnose anything, including ADHD. And it's also important to note that any child at any time may exhibit one or multiple of these signs and symptoms. The difference between that child and a child with ADHD, according to the American Psychiatric Association, is that the ADHD child will show signs and symptoms, at least 6 of these signs and symptoms within a 6-month period, and those signs and symptoms will occur frequently, which is the key word. So what causes ADHD? Well, we really don't know. It's still largely unknown, but possible links to ADHD include heredity, mothers being exposed or ingesting cigarette smoke during pregnancy or alcohol use during pregnancy, a child who's born prematurely, or possibly having a traumatic brain injury. So let's get to what we can do to give all our students the best chance at success. There are multiple types of interventions that we as teachers, parents, and medical professionals can incorporate to help manage the symptoms of ADHD. One of those interventions includes behavior. We can set clear classroom expectations for all of our students. We can choose to praise positive behavior. We also want to take time to think through the situation and pick our battles. We don't have to get into it with every child over every situation that occurs. If we notice a child is making progress and taking steps to work on their behavior, we need to praise that instead of the minor negative behavior. Be clear and specific. Treat every student as an individual. What works for one student may not work for every student, and we shouldn't assume that that would be the case. Use rewards and consequences consistently. Please do not throw out threats that you are not going to enforce. A child should know what the expectation is, and they should know what the consequence is for not following that expectation. So be consistent so the student knows what to expect. Keep communication open with parents and caregivers, and use timeouts when you need one or when the student needs one. Parents can be some of our strongest allies in the classroom. If you have a student in your class who has been diagnosed with ADHD, encourage them to know their rights. They need to know what is expected of them, what is expected of the teachers, what they can expect from medical professionals. Please encourage them to know their rights. Collaborate with parents consistently. The more consistency the child has at home and at school, the better off everybody's going to be. Share educational opportunities with parents. Encourage them to attend seminars or webinars, or maybe print off a reliable document that you found, and share that with them. Keep the lines of communication open, and try to keep those lines of communication positive when you can. Not every negative behavior needs to be reported to parents, and try to help them focus on the positives of their child instead of just seeing the negative behaviors. Medications are another effective intervention for treating the symptoms of ADHD. There are two types of medications used to manage ADHD. Those are stimulants and non-stimulants. Stimulants are the most commonly used. If a student is on medication for their ADHD, the teacher should be informed of any changes to their medication so they can be watching for any changes in behaviors. If you do notice a change in behavior, these need to be reported to the parents or the medical care provider if you have access to that and the proper documentation has been signed. Academic interventions are some other things that we can do in the classroom to relieve some of these symptoms. Those include know the student's strengths and needs. And all of these academic interventions are things that we can be doing with all of our students that are just going to make classroom life easier for everyone, but are specifically important for students with ADHD. We can limit the number of directions we give at one time, so breaking those down into simpler steps. Once the child's completed those steps, moving on to the next. Write directions down. That way, if they happen to forget or get distracted, they can go back and look at the written directions. Offer alternatives. If you've assigned 20 problems for your class and you know that student's probably going to lose focus halfway through, go ahead and give them 10 or 5. If they know how to do the first 5, go ahead and let that be the end of that assignment. Or maybe you can even sit beside them and offer encouragement and support to keep them focused. Break down tasks into smaller pieces. Maintain structure. Utilize and model the use of organizational methods. The more organizational methods we can teach our students, the better off they're going to be. Those things can include student planners, calendars, keeping a notebook, or maybe a chart on their desks where they can move the Velcro pieces to stay on task and what they're supposed to be doing. Provide opportunities to build peer relationships. That's great for all of our students. But some kids with ADHD may struggle to have relationships with other students because of their impulsive behavior and the constant disruptions. Other students may avoid that child because of those behaviors. If you can encourage positive peer relationships in the classroom through group work, fun activities, maybe picking a student who handles it a little bit better and grouping them together occasionally, that's best case for the student. Keep lecture time short and precise. We can all appreciate that. We also need to provide an environment that supports focused learning. This involves reducing distractions. We don't have to have all kinds of posters on our walls and things like that to distract a child. Our bulletin boards can be kept simple with just basic information. Choose your seating arrangements wisely. Students with ADHD may do better in the front row near the teacher where they're not easily distracted and can keep their focus on what you're doing. Check the lighting in the room, change that if you need to. Provide flexible seating. If the child's moving around the room but still paying attention, maybe that can be a flexibility issue on your part, and you can learn to adapt to that child moving around to a seat in the room where they're more able to maintain focus. Create safe space for movement. Remove anything that may cause the child to trip if they're getting up or cause any harm to them or any other children in the room. Place classroom rules and expectations clearly so that all students can see them. It's important to remember that families of children with ADHD are under more stress than the average family. They are dealing with the same behaviors at home that you are in the classroom all day. This can cause excess stress. They're dealing with more behaviors and developmental and educational setbacks than the average family. That constant negative feedback can wear on a person, which is why it's also important for us to share some of those positives and be a positive influence and advocate for that child. The behaviors of the child with ADHD may negatively affect siblings in the home because so much attention is going to that child. They may have higher risk of substance abuse. So offer support and not blame whenever possible, and never blame a parent for the child's ADHD. So that concludes my presentation on ADHD.